Hi, audience, ladies and gentlemen, folks. I'm Dr. Fazil. This is February 2024 episode of Dr. Fazil TV show. Welcome, and thank you for watching this show. Today, the topic of discussion is valley fever, and the reason I want to bring topic to for the discussion today is because this is, in my experience, has been probably underdiagnosed in Arizona. We are in a desert state, and in the desert, valley fever is a pretty common problem, but a lot of patients are not aware of it. Even providers sometimes overlook it, and it can cause a lot of problems in your health. And sometimes it is mild, sometimes it is a little bit more severe, and it's treatable. So making thought about it, like thinking about it, like in certain states, like in eastern states, we have in US we have Lyme disease that is caused by the ticks. But likewise in southwest states, especially Arizona, New Mexico, and states like that, we have where we have a lot of sand and dust and deserts. We have a infection in the lung known as valley fever. So today we're going to talk about a little bit of the symptoms, how the patient feel about it, how you will feel if you get valley fever, and how it can be diagnosed, and how can we treat it, right? So that's a few things we're going to talk about it. Valley fever is caused by a fungus which you can inhale. The spores of a fungus known as coccidomycosis, and you can see this is the fungus right in front of me. That's a valley fever fungus, and the spores can go, let it go. And basically, the valley fever is fungal infection in the lungs. I mean, you can get it in other parts of the body as well. If you have low immunity, it can spread different part of the body, especially patients have HIV, those kind of immunodeficiency disorders. But mostly, it stays in your lung. And the symptoms are mostly fatigue, tiredness, and a lot of sweating, and joint pains and aches, right? So it's like not very specific symptoms or signs, but mostly systemic symptoms are like, as I said, it could be fatigue, tiredness, sweating. A lot of patients do complain about sweating, so when they do complain, I think that's a good idea to be checked for valley fever. The other thing is it can cause cough, shortness of breath. It does go to your lungs, so the symptoms would come from lungs. So here you can see in another hologram right here. So you can see this is the lung, right and left, and there's a fungus in there, and it can grow, and it cause a cavity formation. So cavitary lesions, like a little cavity in the lungs, if you do a chest X-ray or a CT of the chest, a CAT scan of the chest, you will see cavitary lesions. So let this hologram go away.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
What can we do about it? Obviously, if you do suspect that you have valley fever, you should ask your provider that you should be checked for it. It is a blood test. Sometimes you can see some findings on the chest X-ray as well, or CAT scan. But if you do feel like that you may have been exposed by inhaling dust, and if you work in a dusty area or in the desert, then it's a simple blood test. We check the antibodies against this fungus, and then if it is positive, then it can also tell us if you have infection in the past or you have infection now, and then later it can be confirmed with a chest X-ray or CAT scan if you need to further diagnose by further modalities. So that will be the next step. The treatment is sometimes not necessary. I mean, it depends on your symptoms. If it is getting better, then watchful waiting would be also a good idea, but if it is getting worse, it can be used treated by antifungal medication. Fluconazole medication like that, the same kind of medication which you use for toenail infection or infection on your on toes by the fungus. The dose is different, obviously, but it's few weeks to few months of treatment based on the severity of this of your infection. And sometimes I have seen people getting a severe infection. There's another hologram you can see right here. That's a big giant cavitary lesion. That's from the fungus eating up the lung. Those could be a little bit more severe, and then obviously treatment has to be prolonged. So again, folks, do not overlook valley fever. Valley fever can also present with asthma, cough. So if you have symptom of cough and shortness of breath, and it might be misdiagnosed as asthma. So we need to make sure that we are not misdiagnosing or not looking for valley fever. So that is the basic information about valley fever. So hopefully this information will be useful in your daily life. And again, it can spread to bones and other part of the body parts like brain as well. But again, if you let it spread that far, it will happen. Or if you're immunosuppressed, you're taking any chemo medication for cancer or certain kind of other immunodeficiency as HIV, it can spread fast as well. So we need to be watchful for that. On that note, that was Dr. Fazil's show. So have a wonderful New Year, and God bless you, God bless America. And I will be back in the next episode with more useful information for you guys. Thank you so much for watching Dr. Fazil TV show.